It ends and starts again with the relationship. Why do we have to do what we do? And the reason we have to do what we do is because we understand the issues and the barriers that black men and all men of color really face.
Usually, you don't see things that are focused on our well-being, right? This is focusing on our well-being holistically.
We're meeting people where they're at, and then also it's not hard to meet people when you already are part of the conversation, when you're a part of the culture. So that alone helps kind of bridge that gap between the fear and the mistrust in medicine, and then also actually having people say, oh, these experiences can be good, they can be enjoyable, they can be informative, and they can be non-judgmental.
Even though, the Black Men's Health Clinic sees everyone, right? But its focus is target population on black men who need this kind of relief.
We try to remove all the barriers that they face to make sure that they can be in a safe place, a place where they can be restored. It's a place that gives hope and safety. Our tagline is, care you can trust.
The MAP program is Travis County's indigent care program. It's a critically important program. It's one for which taxpayers here in Travis County decided they were going to increase their property taxes to ensure folks who otherwise might not be able to access care of their neighbors could gain access to services. We know Austin is become less affordable over the last several years. And yes, they may have insurance, but they're not able to afford the co-payments because the cost of living is so high.
Just understanding that when you're dealing with a certain population of under-resourced or maybe homeless or unhoused individuals, they have a lot of more barriers than your average person. Imagine sleeping outside in a tent and waking up trying to get to a doctor's appointment. So you have transportation barriers, you have mental barriers, you have long-term substance abuse where these individuals are trapped in this lifestyle and in this environment, and they can't even get to these appointments.
We go to where men work, live, and play. We don't set up a clinic and say, come to us, but we go to you. And we do that through basketball league sponsorships, barbershop. We don't just bring you into our space and wish you well. We walk this journey with you for life.
I think that's what's probably most unique is I've had folks say, why wouldn't you just do this yourself? Why wouldn't you just directly employ the outreach staff? I think we gain credibility through the credibility that Black Men's Health Clinic has.
Let me just express my appreciation for all that have supported this vision. It was out of the box. It was something that others have not done before. Everything we are doing and have done is for others. 35 years in healthcare administration, this clinic, this project that we brought together means more to me than anything I've done.